Hello, I'm Forrest Mahan, President of Aiken Technical College, and I welcome you to another edition of Mondays with Mahan. This week is National CPR and AED Awareness Week, and I have a special guest today, Jonathan Jones, Department Chair of Allied Health here at Aiken Technical College. Jonathan, welcome, and tell us what, first of all, CPR and AED stand for.
Thank you. Yes, CPR stands for cardiopulmonary resuscitation. Basically, when the heart stops, we're going to try to get it going again. And AED stands for automatic external defibrillator.
Okay, so what we often see from the statistics is that about 70% of out-of-hospital cardiac arrests take place at home. And so therefore, cardiac arrest means the heart is stopped. What is the first thing anybody should do if they have a loved one who's gone into cardiac arrest?
Well, one of the first things that we train in CPR is that first they need to make sure that the patient is alert, and if they're not, then they've indicated that they're possibly in cardiac arrest. The most important thing is that they need to call 911. So that way, help is on the way. Then they would start with CPR. If they have an AED available, they may send somebody to go get it, or they may run and get it themselves quickly. But getting the CPR started first and foremost is a very important step.
Now, of course, this is a national effort to make people aware of CPR and AEDs, but here at Aiken Technical College, we are one of the providers of that training for the American Heart Association and the CSRA. So why don't you tell the people who are watching what we do specifically here to help with training? And you have some demonstrations right here.
Yes, we are an American Heart Association training site. You have training sites and training centers. And what makes that different is that we not only provide the training for American Heart Association, but we also manage and coordinate instructors in the CSRA. We have numerous instructors with the Aiken Public School System, as well as the South Carolina Criminal Justice Academy that we help manage and make sure that they're doing the training the way that AHA wants them to conduct it.
Now, if someone goes into cardiac arrest, every second counts. So you said call 911 would be the first thing, but then the CPR as well as the AED, what does that do in terms of time?
So what we're looking at is with the patient that is in cardiac arrest, the longer that they are not having any type of cardiac activity, the more likely they are not going to survive this event. So the quicker that that is done, the more likely they are to survive. So even when an ambulance gets there with all the tools and medications that they have, the thing that saves most patients in cardiac arrest is good early CPR and early use of an AED.
Now, 30 years ago, I was trained in CPR, and it was mouth to mouth, but that has changed. What do we now call the CPR technique?
So for those that are not in healthcare, we do what's called a hands-only CPR training. And what that means is you're just going to do the compressions. And there was a couple reasons why they changed that. One, a lot of people who were certified in CPR were very hesitant of starting CPR on a stranger because they didn't want to do mouth to mouth, especially with communicable diseases that could be out there. So the second part is getting that heart pumping and getting the blood moving. There's still some residual oxygen in the bloodstream, so the breathing part isn't nearly as important as getting that heart going. So by having them do the compressions, at least they're getting that blood flowing.
Now, if anyone would like to learn this technique, you can contact us at atc.edu and then look under American Heart Association, and the availability of space for training will pop up, correct?
That is correct.
And then these demonstrations are done here. How would these be done in person? How do you demonstrate for someone to learn? You have an infant and you have an adult.
That is correct. In adult, we also teach with children as well. It's very similar. But our mannequins here are actually state-of-the-art. They have biofeedback devices. So as the student is doing the compressions, the lights will indicate whether they are doing it correctly, if they're going too fast, or if they're going too slow. So they can make corrections as they're doing the procedures. And you may be able to hear the little click that tells me that I have the right depth with this patient. So again, the adult mannequin has a very similar biofeedback device as well. They have disposable lungs, so as we do ventilations, we can actually see the chest rise and fall, so that way we know we're doing it properly. When we do the training, a lot of the training is done online through the American Heart Association, so you can do it at your pace. And then you'll schedule a time to come in. It's a 2-hour block. They'll come in, we give them a demonstration on our equipment, we let them become familiar with it, and then we'll test them on their skills, and they'll obtain their certification, which is a 2-year certification.
And a life-threatening event could happen at any time, and the majority of people aren't trained in healthcare. But I know I could save you. Can you save me?
I absolutely could.
So in that instance, it's always good to be trained in CPR and awareness of how to use AEDs if they are available. So Mr. Jones, thank you for all that you're doing here at Aiken Technical College for the community. This has been another edition of Mondays with Mahan. If you feel that you would like to learn this training, again, reach out to us at atc.edu, look under AHA, American Heart Association, and we will be glad to have you trained so that the life you save could that of an individual in your home. Thank you.